I have really enjoyed the experience of learning about implants. My dad doesn't place implants, but we both restore them, so we've worked on a lot of cases together. I've been doing it for 5 years, and just really, it's a very rewarding experience because the gratification you get from being able to put a tooth back or multiple teeth back for someone and kind of restore their dentition and make their mouth whole again is rewarding for me, and also very rewarding for the patients. A lot of times after we're done with an implant case, patients will say to me, "Wow, that was easy," or "Wow, I can't believe that was so simple. I thought it would be much more complicated." And to me, being able to do it as a general dentist and allow people to get all that done in one location, I bring value to my patients by doing that. Implants are the next best thing to what God gave you as your natural teeth. If you're missing teeth, you don't necessarily have to go see an oral surgeon to have your implants placed. I've been placing dental implants for over 5 years now here in Jacksonville, and I've worked with my dad on several cases restoring several teeth at one time. It's a beautiful process and restores aesthetics and function when you've been missing teeth. A lot of times you may have been missing teeth for a long time, and we're able to put those back, and that's just it's a much more simple procedure than you would think. Here in the office, I do all my implants under local anesthesia. So we basically get you numb, and a lot of times you're out in 30 minutes and you have one or multiple implants already placed. Sometimes I go ahead and put the teeth on there that day, and sometimes we wait and let everything heal depending on other factors and bring you back within 2 to 3 months and go ahead and put the teeth on there. So we can basically do a whole implant case from start to finish either within a few weeks or a couple of months. This illustration shows an implant being placed after an extracted tooth. Say the tooth is gone here. This shows a cross-section of the bone where we place this little screw. The middle part is called the abutment. That's made out of titanium. And we tighten that and we go back and put the tooth on, and there you go. It's just like you have your tooth back. Many times patients come into my practice and they're missing a single tooth, but the adjacent teeth are healthy. In this case, the very best treatment you can get, the ideal treatment, is a dental implant. What we do is we judge the bone underneath and make sure it's healthy, and if it is, we can place a small screw. Right there, you see the screw going into the bone. And then this in particular implant has a zirconia abutment, which mimics the inside of a tooth. So a pin is placed to retain it, and then we put a porcelain crown on there that gives you the translucency of a tooth. Nobody will ever know the difference. As we discussed a little earlier with some of our patients, sometimes over time you don't have as much bone as you once did to hold your denture in place. This is especially common on the lower because the tongue and the cheeks down there tend to want to dislodge the denture and make it come loose. This is a perfect example of what we would do to remedy that situation. The denture becomes loose, it's not staying still, so we place a couple of implants in the lower jaw here, and there is a male-female attachment underneath the denture and right here in their lower jawbone. This is a relatively pain-free procedure. You're sore for a day or two, and we come back and we fabricate a denture to snap right on there with 3 to 5 pounds of pressure. It takes about that much pressure to remove it, and so it's going to stay put when you're trying to eat a steak, for example, like Mr. Johnson discussed. This is a great solution for anyone you know who may have had dentures for a long time or may just not like the fit of their dentures and would like something with more stability.